We're stretched really thin, and it's a very difficult time for us.
Doctors, nurses, and other hospital workers treating those who are desperately sick with COVID-19 right now, and they're fighting an uphill battle each time COVID numbers surge and patients flood the hospitals.
So many patients, they're sometimes parked in emergency rooms or hallways waiting for a hospital bed to open. And they're also waiting for nurses and doctors to care for them, according to Dr. George Monks, president of the Oklahoma State Medical Association.
The quality of care we're delivering right now is not the same as what we were delivering a year ago.
What's happening in many systems is that people that have not been in clinical care for some time, maybe they're in administrative roles or have shifted like into risk management or other things, are being recruited back into the healthcare system.
Even before the pandemic, we faced a shortage of doctors and nurses in Oklahoma. Dr. Monk says it's impacting the care COVID and other hospitalized patients receive.
We've had to alter the number of nurses taking care of patients, so that ratio of nurses to patients has changed. And you just can't provide the level of care like we were a year ago right now, because nurses are tending to more patients, they're tending to sicker patients, and there's just not enough staff to go around to take care of everyone.
We know multiple studies have shown over time that the quality of care is better if you have fewer patients per nurse.
There are few, if any, reinforcements to be hired from other states, especially those surrounding Oklahoma, because they're in the same situation, which leaves those already here stretched thin and doing their best to care for wave after wave of COVID-19 patients.
But we've created the capacity on the, through the strength and stamina of the healthcare staff, the nurses, the physicians who are working extra shifts, working longer hours to expand that capacity as much as possible. And that's a heavy burden on the staff, and they can't do that forever.
When we start recruiting people back into the clinical circumstances that haven't routinely provided clinical care, again, whether you like it or not, your skill sets go down.